Okay, great, guys. So thank you so much, Jen. Again, my name is Dr. Emily Cottrell. I am so grateful to be here, coming from Allegheny Health Network, where I am a psychiatrist and a family medicine physician. So I do primary care and psychiatry medication management for folks in a clinic sort of outpatient setting. Grateful to be here. And some of you may have attended group back in October when I last spoke. See maybe some familiar faces and names. So I gave a talk then about the trauma associated with receiving a cancer diagnosis, something that I think it's very under-recognized and or just not sort of made explicit, not spoken about. So this is actually a follow-up discussion to that discussion, which was let's say a hearty one. We had a lot of active participants in that discussion. And so we're going to dive a little deeper into specifically the topic of how to build resilience to reduce the trauma response and negative emotions associated with being diagnosed with cancer and treated for cancer, as well as just being resilient and handling life's challenges in general. So I'm going to go ahead and share my screen because I have a PowerPoint to show you. Okay. It would help if I went to the beginning. Here we go. All right, here we go. So that's me. This is our topic. And I like this background because it's nice and sunshiny. It makes me feel better, even if the weather is not cooperative, though today was a nice day, as Jen mentioned. So just to go back to that previous topic that I started in October, just talking about trauma associated with being diagnosed with cancer and everything that comes with it. And then also the follow-up, the aftermath of that. I just want to illustrate for folks how common it is that folks diagnosed with cancer will go on to develop an emotional response that's so big and that's so impairing and strong that it's enough to be diagnosed with a psychiatric illness, a disorder, or multiple disorders. It's a substantial proportion, as you can see here. And the impact of those mental illnesses on quality of life, as well as progress in cancer treatment itself, cannot be overstated. So though I prescribe mental health medicine for a living, that I tell patients all the time, that's sort of what I get paid to do, but I don't think it's necessarily the end all be all. I don't think it's appropriate in every single situation. And it's just one tool in a large array, in a toolbox with a large array of tools in it, for keeping folks well when they're emotionally struggling. So today we're not going to talk about mental health medicine, which is again what I get paid to do. Instead, we're going to talk about the other tools in our toolbox that are just as important, if not more so. And so we're going to focus on the practical aspects and behavioral strategies to foster resilience, that big important word that I will define and talk about pretty extensively today. And these are tools that I didn't just make up. These are things that are supported by scientific research. They are proven to be both helpful and also safe. So next, let's talk about resilience. So as a reminder of what I mean when I use the term resilience, I'm referring to one's ability to maintain or restore relatively stable psychological and physical functioning when confronted with stressful life events and adversity. So, like, to kind of use a popular metaphor, like it's our ability to keep the ship even keel, even in stormy seas. Like, this is how we just maintain stability. That's what resilience is. And it's not necessarily a trait or a characteristic. It's not just like baked into our DNA per se. It's not like a personality trait. It's a process. It's learned and it's cultivated over time as we kind of figure out how to shore up our defenses and adapt in the face of adversity and challenges. So neuroscience research also tells us that resilience is the key to a happy brain. And happy brain is like obviously a sort of a fun, not necessarily scientific term, but actually brain health is a key part of this. So I'm not promoting this particular company in any way, but this is the reason I'm bringing this up is because there's a really helpful video that I would like us to watch about what I mean by a happy brain, what makes a brain happy. This is a physician-founded organization dedicated to advancing resilience and well-being research specifically. So this is like a hot topic, thankfully, amongst research studies and studies that are funded. And I'm highlighting it because this physician, Dr. Sood, creates educational material that is easy for like the non-healthcare professional to digest and understand. So I'm going to attempt to show a very adorable video that he created and narrated actually with his child about the importance of having a very happy brain. Okay, so I'm going to exit out of here and show you guys the video. And of course, please let me know if the sound doesn't come through. It worked earlier when we tested it.
We're still seeing your slides. Are you?
Oh, hang on. All right, hang on. Let me try this one more time. Share screen, share sound. One more go. Okay, can you see the?
Yes.
Okay, good. There, now it should work. Let's go back to the beginning.
A very happy brain.
Friends, this is the story of how Broody, a very unhappy brain, became very happy. You see, Broody struggled with fear and self-doubt. He felt unsafe and unworthy. He didn't know what to do. Then Broody's friend suggested an idea. Together, they went to school to learn about the brain and about themselves. Come, let's find out what they learned.
A short course in happiness. Your brain has trillions of junctions that magic millions of its functions. Let's learn about 3 traits of the brain that in overdrive can get you drained. First trait, your brain feels others' pain as its own. Your brain hurts just the same, in personal or beloved's pain. The same neurons fire when you are in despair, and when someone else is hurting about whom you care. Second trait, for your brain, imaginary is real. Your brain lights up the same nerve bundles for events real or imagined stumbles. If you dream of a spider on your shin, it might cause the same dread as the real thing. Third trait, the brain can't tell physical pain from emotional hurts. The pain of a mean scorn stings the same as agony of a hurtful thorn. Broken bone and broken heart both cause the same smart. Millennia ago, the spiritual minds scribed in their devotions, hymns, and rhymes the same truths that the scientists of today write in theses, books, journals, and essays. What do they all say? To find inner contentment and plenitude, snug yourself in the comfort of gratitude. Your greatest joys come from passions that are lush with true and deep compassion. Once you're lost in healing others and start seeing strangers as brothers, your brain will become the happiest of all, be it summer, spring, winter, or fall. When you pray for others, share their feeling. In touching their lives, you will find healing. Help others feel safe and cherished. The joys in your brain will surely flourish. If you agree, then don't wait. Don't miss the feast, nor leave it to fate. Start with the one a breath away. In this moment, now, today. Start with the one a breath away. In this moment, now, today.
Broody the brain came back from school with 2 important concepts. First, seeing others in pain, physical or emotional, fires his own pain network. And second, his imaginary fears cause him real damage. The school also taught him solutions to these neural predispositions through cultivating deeper gratitude and compassion. The daily practice of gratitude and compassion made Rudy happier and stronger than ever. He defeated fear and self-doubt, and then felt safe and worthy. The brains that feel safe and worthy become happy. Happy brains, when they get busy in meaningful, creative, and altruistic activities, become very happy. Here is the secret to a happier life. Because of the way your brain operates, the pursuit of gratitude and compassion will make you happier than the pursuit of happiness.
Thank you for your attention.
Okay. So I'll get back to my slides here. My favorite quote from that entire is the quote he says at the end, where he talks about how pursuing gratitude and compassion is more important than pursuing happiness. And because that is actually proven by science, that is the whole basis of resilience and well-being research. So that's what we're going to talk about: how to pursue those aspects, those traits, those skills that we use to keep our brains happy and well, and thus our emotions happy and well. So let me get back to my PowerPoint here. Hopefully. All right, cool. Okay. So I mentioned this a little bit with the last presentation in October. I just want to pull it back up because it's obviously relevant as we launch into the skills and the strategies that are research proven to promote resilience. So there are a number of different components of resilience, and here are just a few. Some of these may really resonate with some folks. Some folks may have other components or factors of resilience that keep them well that are not on this list, and that's okay. So your version may look a little bit different than this, but these are the ones that typically are characterized in research studies. And in behavioral health interventions for promoting resilience. And I mentioned also in my October presentation, there's an entire community of resilience writing and research and support specifically for folks that are in cancer care. This book, particularly called Roads to Meaning and Resilience with Cancer, it was written by a physician, but basically this physician compiled 40 patients' stories about finding meaning in their lung cancer diagnosis and treatment journey, particularly with their approach to the key areas of stress management, coping skills, mindfulness, and goal setting. And this book is on Amazon. It's sort of widely available. I just wanted to make sure I included it here: Roads to Meaning and Resilience with Cancer. And the rest of this presentation is going to shift into focusing on those practical strategies, those ways to intentionally cultivate resilient skills. And again, that are all well-researched, supported by science, and safe for everyone to use.
Excuse me, could I ask a quick question?
Sure.
So on the prior slide before the one we were just looking at, when you had the different characteristics, that's it. The self-efficacy, are you going to describe or define what that is? I think the rest of them are, easy to understand, but the self-efficacy I was thinking about.
Sure. So self-efficacy is actually, and I'm glad you brought that up, because sometimes if I ever use a term that's not clear, I'd be happy to stop and explain. So self-efficacy is basically our confidence in our ability to manage problems, to problem solve, to basically approach daily challenges in life. So it's basically like our confidence in our ability to accomplish what we need to. So it's like self-efficacy is the sense of I can do what I need to do every day. I can take a problem and I can approach it, and I can, adapt and face any challenge that comes my way.
Okay. And
Mm-hmm.
thank you for that. And
Sure.
just to pivot off of that, are there little exercises or things one can do to promote the self-efficacy?
Yes. Yeah. And that actually self-efficacy is one of the factors that's baked into these strategies, these recommendations or skills that I'm going to go through. If
Okay.
I don't specifically touch on how they can help you build self-efficacy, let me know. Or if you still have any remaining questions at the end, we could definitely talk about that.
Thank you.
Sure. No problem. All right. Move forward, please. There we go. Okay, so the first strategy we're going to call changing the narrative. So when something bad happens in our lives, such as a cancer diagnosis, a cancer recurrence, we often tend to think about it or relive it over and over and over and over, like our minds are stuck on repeat. That's called rumination. It's one of the most common things that I see in mental health treatment, but also just in life. We all tend to do it. And it's cognitively spinning our wheels. We get stuck and immobile and unable to move forward with adaptation, with growth, with acceptance. So changing the narrative helps us address that rumination process specifically and helps us move forward and get ourselves unstuck. So the process of so this is the actual strategy. The process of expressive writing helps us move forward away from those ruminating thoughts by helping us gain new insights about the challenges in our lives. So the process it's very simple. It's quite straightforward. It's 20 continuous minutes of free writing. And I mean like stream of consciousness. Don't think about it too hard. Free writing about the issue we're stuck on, using language to express our deepest thoughts and feelings about it while we're not worried about the grammar, the sentence structure, and so on. It's not meant to be perfect. It is meant to be a representative of our thoughts, of what we're stuck on, our thoughts and our feelings. And the goal is not to make it like pristine enough to publish. The goal is to confront our ideas on the issue that we're stuck on, and each idea one by one, and give them shape and a description in language. So a study done in 1988 showed that the benefits of doing this exercise actually last far longer than the period of time you're doing it. So participants, and 1988 is a long time. A long time ago, there's more recent studies, but in 1988, participants who did this for 20 minutes of expressive writing for just 4 days in a row, that's all, were physically healthier up to 6 weeks later, and happier. Their happiness scores, and they're actually, believe it or not, there are research proven ways to measure happiness up to 3 months later, as compared to participants who only kind of wrote about superficial topics. So the control arm of the study showed basically the comparison was between folks who were still writing 20 minutes every day, but they would write about superficial things like, the events of the day or the weather or something like that. And so studies have also shown us that exploring the dark side, like all the big bad emotions associated with an experience, gives us the space to contemplate the upsides, to think about the positives. And there are lots of benefits to doing this. So a more recent study in 2014 showed that doing expressive writing every day for 3 weeks allowed participants to become more engaged with life, even after the study was complete, and decreased their burden of pessimistic beliefs over time. So folks who participated also reported lower symptoms of depression over time. And I'll note in that study, the 2014 study, actually, that the beneficial, the positive effects actually seem to wear off after about 2 months. So this is clearly one of those skills that we need to hone and use and maintain regularly for the benefits to be sustained. So again, it's a little bit, it is more deep and more emotionally charged than just journaling. It is intentionally meant to be about the issue that we're struggling with and trying to explore. And just writing about it for 20 minutes a day has a lot of benefit. Okay. So that's the first skill we're going to talk about here. The second one is a toughie, tough for everyone. It's facing your fears. And we'll talk about what I mean by that when I say face your fears, because that sounds like a daunting thing. So the expressive writing piece, the one we just discussed, specifically is meant to help us kind of understand and develop new perspectives about events from our past. Facing our fears is meant to deal with things that are happening in the moment. So deal with our current situation, current state of affairs, our fears in the here and now. Okay. So overcoming a fear, the practice of doing this is designed to help us move past fears that negatively impact our everyday lives. So for example, I work with a lot of patients who are very fearful of medical care, very fearful of hospitals, interacting with medical providers, undergoing tests and scans. And you can imagine how that kind of balloons for somebody who needs a lot of medical care. And a lot of times it's related to trauma. It's related to medical trauma. Like we mentioned, being diagnosed with cancer and in treatment and undergoing all these tests can really be very traumatic and very triggering. So fears like this, though we know that the fears are out of proportion to reality, we know they're exaggerated because that's what a phobia is, right? We can't talk ourselves out of them. It's not that simple. So just telling yourself this is irrational doesn't help. So the approach is to confront those emotions directly by slowly and repeatedly exposing yourself to the thing that scares you in small, manageable doses. So I'll give you an example of what I mean. This may be the person who knows that they have an upcoming test or an upcoming surgery at the hospital, and they start practicing for it. So they start practicing for that event by gradually exposing themselves to the hospital environment, let's say. Let's say they first decide, let's say a week or two before the event, they drive to the parking garage and then they drive home. Then on the next time they go, they park in the parking garage and then they walk to the front entrance and sort of trace, the path that they're going to need to take on the day of. And then they get each time they go, they get a little bit further along on the path so that when the day comes, they can feel reassured that they've already done this before, that this is old hat and that nothing bad came of it, and that they were able to work through it. So this type of therapy is actually a hallmark of treatment by professional psychotherapists for certain types of anxiety disorders, phobias, OCD, a number of different types of anxiety disorders, actually. And it allows us to change the response associated with a particular stimulus or trigger over time. So like an upsetting or fear-provoking event, so that eventually our brain and our body can learn that we're very likely to be okay, that we're very likely to be safe, or at least that we can get through the event or through, the fear-provoking situation and come out the other side, right? So, and it is not reasonable to assume that every fear is going to be extinguished or gotten rid of completely, and that's okay too. But the goal is just to be able to build up more courage to confront it. And this isn't something that you have to be in psychotherapy with a professional to do. This is something we can do on our own in kind of small, manageable doses. So that's what I mean by overcoming a fear. And again, these are all just components to building resilience. So this, for some people, and what I'll say is everybody's different. For some people, let's say a handful of these strategies may just come very naturally. For others, they can be more challenging. In my experience, practicing self-compassion is hard for a lot of folks. But we tend to be hard on ourselves, unnecessarily so. So that's what I'm here to talk about, kind of intentionally practicing self-compassion. Okay. All right. So self-compassion, I mean, it's exactly what it sounds like. It involves offering compassion to ourselves, not to others, necessarily, but also to others, but specifically to ourselves. Confronting our own suffering with an attitude of warmth and kindness and without judgment. That I put that in all caps because that's the takeaway point, without judgment. So there are research protocols and treatment protocols for practicing, teaching people self-compassion, sort of having them go through workshops and group studies and everything about this. And in one study, participants in an 8-week, what they called mindful self-compassion program, reported more mindfulness and life satisfaction, lower depression, anxiety, and stress after the study was completed as compared to people who did not participate in the study. And the benefits of it lasted up to a year. So I'm going to give you a specific example of one self-compassion exercise or strategy that you can just do at home, right? You don't have to be in mental health treatment to do it. Anybody can do it. And so I mentioned, the benefits are pretty significant, right? Increased mindfulness, increased life satisfaction, lower burden of depression, anxiety, and stress. Okay, so let me kind of go through like one very simple practice that anybody can do. It's called the self-compassion break. And it's something you can do anytime you start to feel overwhelmed by pain or stress or whatever the case might be. There are only 3 steps, super simple. And these actually correspond to the 3 tenets, the 3 aspects of self-compassion. So step 1 is be mindful. So mindful, I mean without judging, without trying to analyze the situation, just notice what you're feeling. Am I feeling upset? Am I feeling afraid? Am I feeling angry? Am I feeling resentful? Whatever the case might be. And say to yourself, like, this is what it is. This is a moment of suffering. I'm really struggling today. This hurts. This is upsetting to me. Just, again, without judgment, just call it what it is. And then the second step is remember that you're not alone. So everybody experiences these deep and painful human emotions at times. We all do, although the causes might be different, of course, right? Like not everybody knows what it's like to be diagnosed with cancer. Not everybody knows what it's like to have to go into, every test not knowing what the outcome's going to be, or if that could determine something very significant about your quality of life or how long your life is going to be. Not everybody knows what that's like, but everybody knows what it's like to suffer. And say to yourself, suffering is a part of life, or we all feel this way, or we all struggle in our lives. Kind of generalize it and make it feel more like a normal human experience. So you're not alone. And then the third thing in the self-compassion break that you can employ anytime you need it is just be kind to yourself. So like, you don't have to do this. The way that this is taught, you put your hands on your heart. You don't have to do that if you're like in a public space, but unless you just want to, but put your hands on your heart and say something like, may I give myself compassion, or may I accept myself as I am, or may I be patient. Just a little kind of affirmation that says like, I'm intentionally giving myself some space, giving myself some love here and kindness. Okay, so that's the self-compassion break. If you are the person who perhaps has trouble being kind to yourself, and there's supposed to be a picture here, I apologize, it must have fallen off. But anyway, if you're the person who has a hard time being kind to yourself, then maybe you put it on somebody else. So you say, you maybe the exercise that you use instead of the self-compassion break that we just went through, maybe the exercise you use is, how would you treat a friend? That exercise. So here you would compare how you respond in your own struggles and and even the tone you use, right? When you're being compassionate towards someone else or being loving or kind towards someone else. So use that with how you would respond to a friend to respond to yourself. And often this comparison will kind of make you kind of create some valuable reflections, like, why am I so hard on myself? Why am I, what would happen if I wasn't so hard on myself and I was a little kinder to myself? Okay. And then, so this is sort of a three-parter, but then once we're able to develop a kinder attitude toward ourselves, we can kind of pull this all together, again, in a gentle, kind, compassionate voice, into what's called a self-compassionate letter. So this is a 15-minute writing exercise, full of words of acceptance and understanding and compassion, that you write toward yourself about a specific struggle that you feel ashamed of, or something that you feel like is a shortcoming, or something that you feel like you should have done better at. And in the letter, that's where you remind yourself, everybody struggles. You are not solely responsible for this shortcoming. And maybe you think about some constructive ways to be kinder to yourself moving forward and ways to improve. All right, so that's self-compassion. Okay. The fourth strategy is meditation. So everybody approaches meditation a little bit differently. I think some folks automatically kind of feel like, oh, I'm not the person who can meditate. My mind is too noisy. I have a hard time kind of clearing it up. Or some folks prefer the term prayer. They prefer to pray instead of meditate. That's absolutely fine. Sort of make it your own is my point. But the point is, the reason meditation is so important and helpful is because we all have painful thoughts, again, that we tend to ruminate on. I'm going to bring back that same word that I used earlier, places where we get stuck on a lot of negative aspects of ourselves, things that went wrong, things that we're anxious about happening in the future that we can't stop thinking about. And then when we pause and intentionally bring ourselves back to the present moment, which is what meditating is meant to help us do, we often find that things are actually okay, that we're okay in that very moment. So instead of really dwelling on the past or getting stuck on what might happen in the future, meditation forces us to come back to the present. So meditation is mindfulness. It is a technique to help us deal with negative emotions right in the moment when they arise. And it's incredibly deliberate. It helps us work through fear, through anger, through despair, through anxiety, what I call anticipatory anxiety, which is like, what's going to happen the next day and the next day and the next day. And we just can't stop that train. Meditation is meant to help us work through that deliberately. Okay, so one of the most commonly studied mindfulness programs is an 8-week program called Mindfulness-Based Stress Reduction. A lot of licensed mental health therapists are trained in this and use these techniques a lot in treatment. But these are some things you can use at home for sure, which teaches participants, this program teaches participants to cope with challenges using a variety of different meditation practices. And various studies have found that this is hugely beneficial, mindfulness-based stress reduction. It's hugely beneficial for physical and psychological health, as well as those struggling with mental health, mental illness, and chronic physical diseases as well. Okay. And I apologize. Again, some of my pictures have fallen off here, but that's all right. The important part is the words. So one meditation that I'll just go through really quickly for you guys to just have and put in your back pocket if you don't already use this is called the body scan. It is particularly helpful for helping us calm our negative thoughts. So here, all you have to do, the whole thing, is you just focus on each individual body part in turn, head to toe. I actually like to start at my feet. So I start with my toes first and kind of work my way up. And then as you're kind of focusing just for a few seconds on each body part, as you're laying in your bed, sitting in your chair, you know, riding the bus, sitting in your car, waiting in the waiting room for, you know, to see your physician or for a test, at each body part, as you kind of work your way up or work your way down, stop and notice if there's any tension, any places where you feel uncomfortable physically, and kind of tell yourself intentionally to let go of that tension. So strong feelings tend to really manifest physically in our body. That's something I talk about with my patients every single time they talk to me, is like, how are your emotions manifesting in your body right now, particularly anxiety. So people will be like, oh, my chest gets tight, my stomach knots up, you know, I get migraines, my neck gets tense. But this is a way to relax your body one part at a time and kind of just start dislodging all that tightness and tension intentionally as you go through your body scan. And in one study, researchers found that the time spent practicing the body scan was linked to greater well-being and less reactivity to stress. So being more aware of our bodies, the emotions that are associated with how we feel physically, that also might help us make healthier choices too. Like, for example, trusting our bodies when we feel like something's wrong, avoiding commitments that are going to overextend us, for example, when we kind of get that inkling in our stomach or in our chest, like this isn't a good idea, we need to listen to ourselves. And then because, you know, when stress creeps in, for example, the healthy habits tend to creep out, right? Like we make poorer choices with our nutrition, we rest less, we listen to our bodies less when we're stressed. So you know, these types of body-based awareness techniques can also tell us when our body's like, we don't think this is a good idea. We're not doing a great job taking care of ourselves right now. And how can we adapt and do better? Okay. And then the last little meditation I have here is mindful breathing. This can be done anytime throughout the day, anytime you just need a moment, need a break. It involves bringing attention to, it's again, it's not tricky, not challenging at all, just involves bringing our attention to our breathing, which is something our body just does automatically without us doing it intentionally or paying attention to it ever. But when we start paying attention to it, we calm, we center ourselves, we become more mindful. So all you have to do is pay attention to what the physical sensations of the breath, so like the air coming in through your nostrils, the way your chest expands, the way your stomach rises and falls. If you ever do yoga, this is like this is a foundational part of yoga practice, but anybody can do it anytime. You don't have to be in a yoga studio to do it. And then if your mind wanders while you're trying to pay attention to your breath, like that's okay. Just bring it back. Just say, you know what, I've wandered off a little bit. Let me get back to focusing on my breath. I didn't do it wrong. There's no judgment associated. Just need to get back on track and pay attention. And you can do this during like a timed meditation if you want to set a timer on your phone, or like a 15-minute timer, or just in a moment of stress where you just need to center and create some mindfulness. Excuse me. And in one study, participants who did a mindful breathing exercise before looking at really disturbing images during the research study, like spiders or car crashes and things like that, they experienced less negative emotion than the people who had not done the exercise. So they were able to look at those really distressing images and have far less negative emotion associated with it just because they did some mindful breathing beforehand. Our breath anchors us. Our breath can at any given time pull us back into the present and give us, again, that sense that we're okay in this moment. We're going to be okay. Okay. And the last one, also very challenging in my opinion, is cultivating forgiveness. This is the fifth one. So if you're the type of person for whom holding a grudge is like life, like kind of how you go through life, research suggests that cultivating forgiveness could be really beneficial to your mental and physical health. So if you feel ready to do that, it can be an extremely powerful practice. And it is challenging when you make that commitment to forgive. It means letting go. It means letting go of resentment and ill will, but for your own sake, for your own good, not for the good of the person you're necessarily forgiving. It's because you need to do it for your well-being. And the way we start once we make that commitment is to begin by clearly acknowledging what happened, how it felt, how it made you feel, and how it's affecting your life every day, why it's important for you to let go of this grudge or let go of this resentment. And it doesn't mean like letting the person who offended you off the hook. And mind you, this may not even be a person. This may be a situation. This may be an entity that's not like the healthcare system, for example. I can't tell you how many people have a hard time letting go of resentment toward the way they've been treated negatively in the healthcare system, for example. So it doesn't have to be like a specific person, it could be an entity. But the point is, you're not letting this person or this entity off the hook or even reconciling with them. Ultimately, what you're trying to do is find a positive opportunity for growth in that experience. And maybe, for example, that experience alerted you to something you needed, something that you needed to look for elsewhere or in a different relationship. Or maybe you can understand someone else's suffering a little bit better. And then this is a quick, like very quick, hopefully again, practical exercise, 5 minutes. If you're the type of person who has a hard time forgiving, hard time letting go, this exercise is called letting go of anger through compassion. Just helps you get unstuck from that place. So you spend a few minutes generating feelings of compassion toward the offender, whether it's a person or an entity or whatever. Understanding that this person, this entity makes mistakes, they're fallible, they're human, they also have room for growth and healing. And the whole time be mindfully aware of your thoughts and feelings during this process. Notice any areas of resistance or places where you're just like, I'm not feeling this. I feel very stuck. I don't want to move forward here. And that's it, 5 minutes. Okay. So the benefits of cultivating compassion and forgiveness are actually pretty clear in the scientific research. So some people are not convinced that this is something they need to do. Like they're quite stuck in that sort of resentment phase or that grudge state. So if you're not convinced, researchers have tested it against common alternatives to forgiveness. So ruminating, like I mentioned before, on negative feelings or repressing negative feelings, like just saying they don't exist, I'm going to ignore them, I'm not going to acknowledge how I feel about this situation. The research found that cultivating compassion and forgiveness led participants to report more empathy, more positive emotions, and more feelings of control over their life, over their situations, over the problems that they need to solve or figure out how to handle. And that outcome is something that we all deserve, whether or not the people who've offended us or wronged us deserve it. We certainly do, right? Okay. All right. Oh, perfect. So we have about 10 minutes left. I'm going to go ahead and stop sharing, and then we'll stop the recording so that we can kind of have a few minutes for free discussion. But I just put a little question up here, just a little thought exercise, but how do you foster resilience in your own life, or how do you intend to moving forward, that we can maybe discuss in the last few minutes?